So there's a pretty compelling problem statement involved in total joint surgery. Total joint surgery, one of the most phenomenal care lines available in terms of outcomes for patients. So 1 year later, people that will describe the surgery as having been life-altering for them, having substantially improved their quality of life, have substantially reduced their pain, have substantially improved their functionality. So this incredibly effective care that has become enormously expensive to deliver, and then substantially constrained by Medicare and a growing number of the private payers by putting the whole episode into the bundles or shifting them to an outpatient payment methodology. As a result of the bundle, it meant hospitals, health systems, physicians needing to become very adept at, one, getting the costs managed, getting the outcomes tightly refined to create the best fundamentals. So what we were confronting was an incredibly valuable service in terms of care, value to the patient of the care. We were doing it quite well clinically with very low variability, but we were really in a squeeze with cost, and we were really in a conundrum of, could we afford to diminish our investment in the implant technology as one of the ways to underpin the financials and not erode the care? Could we alter those financials without putting the outcomes of the patient at risk? And so what SupplyCopia was able to do for us is they were able to create the supporting informatics architecture. First, they were able to very deeply dive into our supply chain, not only for the fundamental implants related to the total joint surgery, but they could also help us visualize all of the rest of the stuff that went into the cost of the care, including other materials in the operating room. They were able to give us the combinations of stuff that physicians used, and we had no visibility to that before. That very set of fundamental tools that all of us use every day on a multitude of decisions around transactions and how do we choose elements to create value in whatever we do, SupplyCopia was able to help us visualize that. And some really phenomenal insights came from that. It was unbelievable in the variation in materials going into a case. Thousands of combinations among 9 or 10 surgeons. And they were able to then define among the about 10,000 combinations of stuff that people used in their informatics. They were able to help us identify which combinations could most effectively be put together to get the lowest possible cost. And then as a safety net, what they then helped us do was to craft the system by which we could provide surveillance to the outcomes of the patient. They helped us create a composite score made up of mortality, morbidity, length of stay variation, and complications. And so you can now begin to picture what that dashboard looks like. Here is our number of cases that we did this year, number of cases we did last year. Here is the quality composite this year. Here's the quality composite last year. When we did initiated supply chain interventions and began to alter product usage, here's what happened to our costs. And at the end of the day, looking at 1 year to the next, are you able to alter the cost formula for an element of care while maintaining the quality deliverable at a high level? And are you returning an improving net margin to the hospital? That became the fundamental tool set to be able to provide the physicians to be able to start to adjust those various dials. In the supply chain area, I think we've learned a couple of really important things. One is that the choice of the vendor makes a difference, and it's an important factor in the cost. No question about it. However, what we learned from this experiment is that factor alone cannot make the line sustainable, which is to say you can't take enough expense out of the implant to make this line profitable, and is unlikely to ever be that way. The idea that the way that you can influence the financial sustainability of this strictly on the implant, I think has given us some sort of a sobering view, is that we've got room there, but we can't solve the whole problem that way. Where we can solve some of the cost is by continuing to drive the clinical variation to minimal. There's I think, a very significant opportunity in getting, in effect, the receipt of the procedure in real time in the surgeon's hand, the equivalent of the bill of materials being able to be put into the hands of the operating physician in real time. Having a system that is now able, in a highly granular way, able to understand and visualize the bill of materials. And SupplyCopia was able to show us the bill of materials that were things that were used that were not planned. And then they were able to show us things that were used that were not part of, let's say, our joint RFP process. That kind of visibility to the bill of materials, incredibly important now that we are able to put that in the hands of the surgeon. So that's where we go in this next phase. Is this framework gives us a lot of opportunity, and now it's to go further on the testing of putting this into the real-time experience of all of these operators, surgeons included. Can they continue to drive the quality composite up? Can they drive the materials cost down? And can they create a sustainable sustainable revenue formula for the line? It's very, very difficult, notwithstanding the incredibly effective informatics systems of all types that a health system has, to weave this data together in the way that SupplyCopia did in order to be able to achieve the insights that became possible.